Hi, my name is Aaron Oxford and I work at NHS England. We run the NHS England Learning Disability and Autism Advisory Group. This is a group of people with learning disability, autism or both and family carers. The advisory group tells NHS England about the experiences and opinions of people with a learning disability, autism or both. We had a meeting to talk about care people get when they have particular illnesses like diabetes or epilepsy. This is called care pathway. Reasonable adjustments for care pathways. If you have a learning disability or autism, then you might need the care pathway to be a bit different so it works for you. This is called making reasonable adjustments. These could be changes to how long your appointment is, to your treatment, or the information you get. The advisory group gives lots of ideas about reasonable adjustments to care. We agreed that reasonable adjustments should be made around a person and not around a condition. This is because everyone is different. Doctors need to be able to make long enough appointments so that reasonable adjustments can be made. We need to give services examples of how they could make reasonable adjustments. This could be done using videos or stories of good adjustments that other places have already made. It is too hard to make a full list of reasonable adjustments because everyone has different needs. Information about what reasonable adjustments people would like should be included in summary care records and on their health passports. Make information accessible. Information should be accessible in lots of different formats. Speak to the person and not to the carer or family. Make sure the family or carer also understands what has been discussed. Don't use acronyms when explaining things. If you need to, make sure you can explain what these mean. Checking understanding is important. Sometimes people say they understand when they don't. Sometimes people understand in their appointment and forget later. One way you can check if someone has understood is to ask people to repeat back what you have just said. Writing things down during an appointment can also help people to remember. Be aware that people may be embarrassed to ask for help. This could be worse for men. More training is needed for staff about learning disabilities and autism. Staff need to be more aware of learning disabilities and autism and additional conditions people might have. When staff are trained about autism and learning disabilities, this would be a good time to talk about reasonable adjustments. Awareness training would also be a good time to remove the idea that someone who has a learning disability won't do things like smoking or drinking too much alcohol. Everyone should feel welcome and included at support services. Sometimes support groups aimed at everyone may not have the knowledge or know how to include everyone properly. For some conditions, this may be enough people to make a separate support group for people with learning disability or autism or both. Things people said about diabetes care. Give simple messages to people about how they can prevent and manage their diabetes. Be sensitive about the words you use around diabetes. For example, some people can be sensitive around the word fat. Instead, you could talk about lifestyles increasing risk of diabetes. Some people can find it hard to understand what they can and can't eat when have diabetes. This could result in an eating disorder. Doing a check for eating disorders would be useful. Be clear about what is healthy and what is not healthy, and make sure your staff are trained on this too. It would be useful to have a place that people can go to get information and advice about diabetes if they have a problem, like an accessible website or helpline. Have a smaller choice of things like diabetes pens, and the same rules about paying for things. Make things the same around the country would be less confusing. Things people said about care for dysphagia. People often don't know what dysphagia is. Using difficulty swallowing would be more helpful. It can be dangerous when people don't know what dysphagia is. People might offer someone with dysphagia things to eat which they cannot swallow. This can happen anywhere, including in hospitals and secure units. To help stop this happening, it is really important that staff read care plans. More training is needed for health professionals about dysphagia. Symbols or coloured beakers could help people know that a person has dysphagia. This would work best if it was the same across the country. Things people said about epilepsy care. The language used around epilepsy can be scary, so using simple language to explain things would be helpful. More awareness is needed for the public about the signs of epilepsy. A campaign like the Stroke Fast campaign would be good. Teaching people more about epilepsy will help to make people less scared of it. Things people said about heart disease. People need to be more aware of heart disease. Publicity and education would help. The NHS should concentrate on stopping people getting heart disease by encouraging people to live healthy lifestyles. They should teach children about this in schools. Things people said about autism. At the moment, the work on care pathways focuses on adjustments for people with a learning disability. We asked what adjustments would help for people with autism. GPs should know when their patients have autism, but they often don't. If GPs knew more about autism, it would really help to improve support for people with autism and diabetes. There's a black and white thinking that is associated with autism can mean that a diagnosis of diabetes could leave someone very stressed or with an eating disorder. People with autism find it hard explaining their symptoms. Diagnosis normally only happen at a crisis, and then people can struggle to understand what the diagnosis means for them. So, what next? Thank you for all these ideas. NHS England is using what you have told us to make things better.